statement.
Thank you, Mr. Chairman, and I want to thank our witnesses for being here today. I want to really appreciate your time and the energy it takes to prepare for a committee hearing. Today's hearing is on a medical phenomenon where individuals infected with COVID experience lingering health conditions that may very well be related to their COVID infection. As a physician, I know it's important that we examine this closely to determine the linkage of symptoms and the ailments to COVID-19 and how best to treat such conditions. Without a doubt, many illnesses and injuries can result in intermediate and long-term effects, whether it's viral disease, physical injury, or traumatic events. Reported symptoms of long COVID have ranged from persistent fatigue, respiratory problems, brain fog, and cognitive impairment. At this point, there's still much that we do not know about the cause, nature, and prevalence, and treatment, of course, of this condition. This is especially true given the commonality of conditions such as fatigue, insomnia, anxiety, and concentration impairment, which may stem from a wide range of health conditions. And I'm reminded of the challenge of determining the pathophysiology of chronic fatigue syndrome. In 2020, Congress approved $1.15 billion for the NIH to conduct research on the risk factors and causes of long COVID. Research studies are ongoing, and hopefully those will shed new light on the nature, causes, and possible treatment of long-term COVID. Long-term post-viral effects of COVID are medical phenomena that should be studied so that we can increase our understanding and ability to treat. It is not an appropriate justification for yet another extension of a public health emergency. COVID is now endemic. It is an endemic disease, and we need to treat it as such. Most Americans, as well as much of the rest of the world, have long since accepted that reality, and it's time for our federal government to do the same. Just last week, the Biden administration decided to extend the public health emergency declaration for another 3 months, and who knows if they'll extend it beyond that. While there may not be good scientific or medical reasons to extend the public health emergency declaration, there are quite a few political reasons. Many of the federal government's pandemic-related waivers, funding, and temporary policy changes will end with the emergency declaration termination. For example, the public health emergency declaration prevents states from removing millions of ineligible recipients from their Medicaid rolls. As a result, it's no surprise that Medicaid enrollment has skyrocketed, going from 71 million to 95 million in just 2 years. 30% of the nation is now on Medicaid, even though many of these new additions no longer qualify for Medicaid, because the only ways states can remove someone under the emergency is if they die or move out of the state. In a lot of cases, millions of these Medicaid recipients have returned to work and have incomes above the Medicaid level, and they would otherwise be getting health coverage through their employer instead of through the state. That's 30% of all Americans, because the federal government is telling states that they can't enforce crucial eligibility requirements in their Medicaid programs during the public health emergency as a condition of additional funding. Keep in mind that Medicaid's improper payment rate is around 20%. It is irresponsible and disingenuous for the Biden administration to perpetually extend the public health emergency like it did just last week. It is long past time for this administration to recognize that COVID has become endemic like all coronaviruses. And we can't keep governing with emergency policies indefinitely. Americans understand that we're past the emergency phase of COVID, and it is time for the nation to return to normal. Mr. Chairman, I'd also like to seek unanimous consent to enter 2 articles into the record that I'll discuss during my question period. The first is a study from the Annals of Internal Medicine about the sequelae and immunity baseline findings of a long-term COVID. I'd like to enter that, if I could, in the record.
Without objection.
The second document that I'd like to enter is from a group of physicians who have determined treatment mechanisms and modalities using FDA-approved treatments for other conditions. I'll talk about it when I get my opportunity for questions. And this mechanism that they're using is external counter pulsation therapy. I'd like to enter that as well.
Without objection.
Thank you. Thank you, Mr. Chairman. I look forward to our witnesses' comments.